When you're walking after midnight down the streets dressed in neon light, you wanna get down. When you feel right, you wanna get down.
Fast, discreet, and pay cash on delivery at loveit.ph.
Laugh safely and be safely loved.
I need you to listen to me, please believe me, I'm completely lonely. Please don't judge me when your tears are falling, I'll catch them as they fall. I need you to listen to me, please don't leave me. I'm not perfect yet, but I'll keep trying. When your tears are falling, I'll catch them as they fall. 'Cause inside, we are really made the same. In life, waiting's just a stupid game. Lift me up, give me a start, 'cause I've been flying with some broken arms. Lift me up just a small nudge, and I'll be flying like 1,000 doves. Flying like 1,000, flying like 2,000, flying like 10,000 doves. Flying like 1,000, flying like 2,000, flying like 10,000 doves. I'd do anything if you would just believe me. I am human, invisibly bleeding. When your smile is shaking, I'll catch you as you fall. painter's mind, then I would paint it, or a sculptor's hands, then I would shape it. But instead, I guess I'll sing it in this song. I cried more than I ever say. Each time your love seems to save the day. I need you to listen to me, please believe me, I'm completely lonely. Please don't judge me when your tears are falling, I'll catch them as they fall. I need you to listen to me, please don't leave me. I'm not perfect yet, but I'll keep trying. When your tears are falling, I'll catch them as they fall. 'Cause inside we're the same. In life, waiting's just a stupid game. Lift me up, give me a start, 'cause I've been flying with the broken arms. Lift me up, just a small nudge, and I'll be flying like a thousand you as you fall. I cry more than I ever say. Each time your love seems to save the day. Lift me up, give me a start, 'cause I've been flying with the broken arms. Lift me up, just a small nudge, and I'll be flying like a thousand I've been hurting, stuck inside a cage, so hard my heart's been in a rage. If you love me, then just set me free, and if you don't, then baby leave. Set me free. Lift me up, give me a start, 'cause I've been flying with some broken arms. Lift me up, just a small nudge, and I'll be flying like a thousand. Flying like a thousand, flying like 2,000, flying like 10,000 doves. Flying like a thousand, flying like 2,000, flying like 10,000 doves. And I'll be flying like a thousand doves. Flying, flying, flying like a thousand doves. Flying, flying, flying like a thousand
Hi. So, good afternoon to all our viewers on Facebook, Twitter, and YouTube. I'm Brian Barreto, a proud advocate of HIV awareness, and I'll be your host for today's event, The Explainer, National HIV Prevention Month 2020, towards a hashtag Safer Now Philippines. Let me also greet my gorgeous co-host, Nicole. How are you doing, darling?
Hi, thank you sa pabate. How are you, Brian? Nice to see you.
I'm good. I'm good. I'm excited for today.
That's great. Magandang hapon po sa lahat ng ating manonood. I'm Nicole Silvestre. I'm also an advocate of HIV awareness and trans health, and I'm your co-host for this afternoon show. But first of all, let's also thank the gorgeous drag performance of the fierce, captivating Kat Kat for that wonderful lip sync performance of Lady Gaga's one. Grabe na LSS na ako, Bri.
1,000 doves by Lady Gaga. As the
Yeah.
song suggests, we truly need 1,000 doves or warriors like you to spread awareness on HIV prevention. At the onset of the HIV pandemic, we were seemingly losing the battle, and currently we know that it's far from over. But I firmly believe that we are getting there with all of your help. I also know that we can stop HIV in no time, especially with what's in store for us, which is this National HIV Prevention Month celebration. Bakit nga ba tayo may ganito ngayon dito?
Well, good thing that you asked, Brian, kasi the Philippine National HIV Prevention Month is set every July of every year. And this is actually the first time we are celebrating it. This initiative supports the Presidential Proclamation number 971, signed last June 23rd, declaring the second week of July as Infection Prevention and Control Week.
That's a great thing to learn about this remarkable event. I know that with the help of our highly esteemed guest speakers, we will be able to manage and stop the spread of HIV.
Tama, Brian. Since this is actually the first that we are focusing on HIV prevention on a national level, we will be launching later the campaign promoting the so-called HIV combination prevention method. Ano raw? HIV combination prevention? I know, guys. I know. Later on, we will explain that this concept is all about. Kaya naman, chance natin ito to educate ourselves and other by sharing this live stream on your Facebook timeline, group, and pages. At pwede nyo rin itong i-retweet sa inyong mga Twitter accounts. Also, don't forget to use official hashtag #SaferNowPH on your social media posting.
Thank you, Nicole. So to formally welcome us all and give us an overview of the HIV landscape in the Philippines, I am honored to introduce to you a dear friend of the HIV community. Kindly show some love to Dr. Louis Ocampo, UNAIDS Philippines Country Director, for his welcome speech and presentation on the status of HIV in the country. Hi, Dr. Louis.
Thank you, Nicole and Brian. Good afternoon to everyone. On behalf of all our partners, I would like to welcome everyone to the Kickoff event of the National HIV Prevention Month. And as Nicole mentioned, this event is anchored to the Presidential Proclamation number 971, declaring the second week of July as a National Infection Prevention and Control Week. And preventing new infections is central to ending the AIDS epidemic. However, despite the availability of a widening array of effective HIV prevention tools and methods that we have and scaling up of HIV treatment, we have not made sufficient progress in reducing new infections. And over the past 10 years, we have not made sufficient, the country has shown an increasing number of new infections. Actually, in the recently published Global AIDS report, the Philippines has again broken another record, having the highest increased rate of new infections at 207%. And it is estimated that 16,780 new infections will happen this year. However, we have a good fighting chance to lower that estimate. And that is if we could implement and scale up the HIV combination prevention program. And these are interventions that aim to help the transmission of HIV, and these are being implemented to either protect an individual and their community, or it can be rolled out as a public health policies. In 2014, UNAIDS set an ambitious worldwide target to reduce annual new infections to below 500,000 by 2020, which is a 75% reduction from 2010. And it is called the UNAIDS Fast Track Strategy. And achieving such reductions would mean the HIV epidemic can no longer be a public health threat. However, again, it is obvious now that the 2020 target will be missed. And for this reason, UNAIDS has described HIV prevention as being in crisis. UNAIDS defined combination prevention as rights-based, evidence-informed, and community-owned programs that used a mix of biomedical, behavioral, and structural interventions prioritized to meet the current HIV prevention needs of a particular group of individuals and communities so as to have the greatest sustained impact on reducing new infections. So lastly, UNAIDS has called for combined approaches to HIV prevention to be scaled up to reinvigorate the global response as well as the country and make a sustained impact on the global and local HIV incidence rates. Again, just sit back, enjoy, and learn more about the discussion on HIV combination prevention programs. Thank you, Nicole.
Thank you, Doc Louis. Very informative and inspirational presentation. To our viewers, again, if you have questions or thoughts, just comment down below and we will answer those as we go on with the show. Don't also forget to share this live stream so more people will be aware of the different methods of preventing HIV.
Okay, Nicole, I will now give you the HIV situation of the country as well as the effect of COVID pandemic. As we know, the pandemic is unprecedented and it has affected actually all health programs, including HIV. Next slide, please. So this is the estimate that we have for this year. As you look at the annual new infections, we are expecting 16,780 new infections for 2020, and it can actually increase, to 20,800 by the end of 2030. Now, looking at the annual death per year, we started at below 500, in 2010. But looking at what we are now, it's around almost 2,000 deaths per year. And if you look at the cumulative number of new infections, including the current cases, in 2020, we now have 111,424. And we started at 16,700 in 2010. And that is why when we computed for the increased rate, it is 207% from 2010 to 2019. Next slide. Now, I mentioned, at this rate, we now have the highest change in new infections in the world. At 207%. In terms of death rate, again, ang taas ng changes from year 2000 to 2019, it's 338%. Next slide. Now, looking at the performance of the country against these targets. So this is based on the epidemiology report. Out of the estimated PLHIV of 111,400,000, we already diagnosed 73,699, and that's 66%. We're now in the right direction in achieving the 90-90-90 targets, okay? But look at the people alive on antiretroviral therapy. Out of the 73,699 diagnosed, only 45%, 4,543 are on treatment, or around 61%. So meaning we need to scale up enrolling those who are diagnosed to start on treatment and sustain them on treatment. And in terms of the third 90, in terms of the viral load suppression, medyo mababa yung uptake natin. are only 11,758 were tested for viral load. And later we will talk about ano ba yung value ng treatment as prevention or U equals U na sinasabi natin. Good thing, out of the 11,758, 96% naman ay virally suppressed. So this is a good indicator. But of course, we want to increase yung uptake ng ating viral load testing. Next slide. Now, in terms of the regional cascade, if you look at NCR, of course, majority of our cases are coming from this 6 regions: NCR, Region 4A, Region 3, Region 7, Region 6, and Region 11. Majority are coming from NCR, okay? So again, in terms of the diagnosis, Manila, NCR is only 74%, treatment coverage is 61%. In 4A, it's only 57% diagnosed, and then only 62% ang ating coverage for treatment. Region 3, it's only 60%. 62% naman ang kanyang treatment coverage. 7, 62%, and then 42% ang coverage. And Region 6, Iloilo, 62% ang ating testing rate. Ang ARV coverage is on 67, and Region 11, 76 and 59%. Next slide. So if you look at the diagnosis and treatment coverage in the Philippines between 2010 and the first quarter of this year, makikita natin no na yung estimated PhilHIV dapat 142 by the end of 2022. For 2020, 111,400. However, ang coverage natin ay 73,000 pa lang. So medyo mahaba-haba pa yung hahabulin natin para ma-diagnose natin kung sino itong mga PhilHIV na hindi pa nadadiagnose. Next slide. Now, of course, there was a notable decrease in diagnosis during the time of lockdown. Since March and April 2020, yung ating diagnosis ay bumaba by 53%. And it plummeted actually by April, 69% ang decrease in terms of our diagnosis. And of course, kung mababa yung diagnosis natin, mababa din yung masisimula natin for treatment. Next slide. Now, also in terms of treatment, ang binaba no since March 26% ang ibinaba natin, and then by April 60% naman ang binaba din in terms of initiation to treatment. Next slide. So, what do we do now? I mean, ano ang kailangan natin gawin para makabawi tayo? Ano yung catch-up plan, na dulot ng ating HIV, ng COVID pandemic? Well, for diagnosis, as we know, kailangan natin na pataasin yung ating self-testing. And I know TLY has already started the self-screening or the self-care program. We need to scale up, na ma-reach lahat ng ating mga high burden areas. And of course, yung RIVDA testing. For treatment naman, of course, we need to continue providing multi-month dispensing of antiretroviral drugs. Okay, it can be through the courier services, and the community-based organizations are also helping us. Andyan yung Oplan Bayanihan na saan inorganize ng ating community-based organizations na kung saan ay they provide free courier services para ma-deliver yung ating ARV. We have to increase ARV access points. We need to identify CBOs to be dispensing facilities. And also, we establish telemedicine, helplines, and of course, yung coordination among regions, LGUs, facilities, and CBOs, including the private sector. Next slide. For prevention, I think we need to strengthen the combination prevention program. And that is why UNAIDS supports this initiative, because we believe that we can only reverse the trend by strengthening the combination prevention program, which includes condom and lubricants or program, the pre-exposure prophylaxis, PrEP, or also post-exposure prophylaxis or PEP, as well as the treatment as prevention or yung U equals U. And then we also need to identify more access or delivery points of prevention interventions. It can be through the community-based organizations. We can establish online platforms for those who cannot go out of their residences. Baka naman pwede, we can bring the services to their homes. Private and public health facilities must, provide an alternative options kung paano nila magbibigay or mag-continue yung services, and as well as implementing HIV programs in workplaces. So I think if we can do all this, yung ating estimate can be reversed, it can be lower, at least, and we will not reach the 16,000 new infections by the end of 2020. That's it. I think that's my last slide. Thank you, Nicole and Brian.
Thank you again, Dong. Very informative talaga yung mga information nito. Diba, Brian?
Yeah, super. I also noticed that I want to repeat that for the viewers, if you have any questions or thoughts, just comment below and we will answer those later on for the Q&A. Okay? Now, yeah, that's why we are celebrating this for the whole month, because we also want to highlight that highlight all the HIV prevention methods so that we can truly bring our kababayans to a hashtag Safer Now Philippines.
Tama, agree ako dyan, Bri. Now, my question is, sa mga probinsya ng bansa, gaano natin pinapahalagahan ang pagiging safer? To cite an example of status of HIV at a regional level, let me call on Mr. Trio Paras, the representative of Central Luzon Regional TB HIV Support Network, who provide a picture of efforts initiated and sustained in region. Yes, Sir Trio.
Right. Sorry. Hello, everyone. Good afternoon. My name is Trio Paras, and I'm the program coordinator for the Central Luzon's Regional TB HIV Support Network, which is actually a part of the regional coordinating committee for TB HIV, handled by the Department of Health Central Luzon Center for Health Development. So as what our host mentioned earlier, so I'm here to discuss with you. Actually, I just have a very, very short discussion about the efforts and initiatives of Region 3 as far as HIV prevention is concerned. Okay, so my very short discussion would go around the 4 components of HIV prevention. Okay, so for everyone's information, so all of these initiatives are actually spearheaded by the Department of Health Central Luzon in collaboration with the RTHSN, or the Regional TB HIV Support Network, also with our LGUs, or the local government units, the government hospitals, the HIV treatment facilities, and of course, our government and private partners. Okay. So first and foremost, let's start with condoms and lubricants. Okay. So for condoms and lubricants, our first initiative, we are actually so proud about this. This is an annual campaign for condoms and lubricants, which is being observed or celebrated during Love Month. We call this the Safe Love campaign. So this is basically a repackaged initiative which focuses on promoting a culture of safety and protection, or otherwise known as, we call it condom culture. Okay. Second to that, we have a collaboration with the Family Planning Program, wherein we have procured condoms and lubricant dispensers, in which are actually being distributed or have already been distributed to different rural health units, HIV treatment centers, DOH hospitals, and even on private establishments. Okay? Also, we have now included condom and lubricant distribution to our ARV refilling clients and also to those clients who are for ARV delivery. So they are also getting condoms and lubricants every time that they refill for ARVs. Okay. Next part, we have the pre-exposure prophylaxis or PrEP. So far, for Region 3, we have a total of 8 PrEP centers across the region. These 8 PrEP centers have established referral mechanisms with our treatment, our HIV treatment facilities. Second to that, we also wanted to highlight that we have a collaboration with the Love Yourself Incorporated in capacitating our peer educators to become preppy peers. That's how they call it. So preppy peers wherein they are to aid in providing or boosting awareness about PrEP. Okay. Also, on the part of post-exposure prophylaxis, we are actually very grateful that all of our HIV treatment facilities are now or have actually been consistently offering post-exposure prophylaxis. For treatment as prevention or TASP, we are so proud that Central Luzon has a total of 375 HTS facilities or HIV testing service facilities. As mentioned earlier, we have now a total of 28 HIV treatment centers, 42 social hygiene clinics or reproductive health and wellness centers, which are offering HIV testing and STI management. We have 13 support groups and CBOs, which is all anchored under the regional TB HIV support network. And also, we have the Lifesaver campaign. So what's good about this Lifesaver campaign, as mentioned, all of our existing clients or our service receivers are being capacitated, included in our program implementation. So what happens is that majority of our support group members, the CBO members and volunteers, the community center volunteers are being trained for the different HIV-related trainings. Okay. Did I forget anything? Actually, that's most of the initiatives that we have for Central Luzon. And we are really hoping that other regions would also, if not replicate, we would be able to get idea on how to be able to enhance their existing programs. Thank you, Paul.
So thank you, Trio. That was an impressive and eye-opening presentation of your efforts in Central Luzon. I hope that other regions across the country are also keeping up their programs to finally curb HIV. So before we move on, let me just acknowledge those who have made the National HIV Prevention Month celebration possible. The explainer towards a hashtag #SaferNowPhilippines is presented to us by Skip-Up Philippines and Champion Community Centers, sponsored by the Rotary Club of Cubao, QC District 3780, brought to us by Durex, Love It, 3M, Bliss, and supported by UNAIDS, AIDS Healthcare Foundation, Filipina Shell Foundation Incorporated, the Australian Federation of AIDS Organization or AFAO, APCOM, and Love Yourself Incorporated.
Maraming salamat po sa ating mga partners at sponsors. The National HIV Prevention Month is not just a celebration, but a movement to promote the HIV combination prevention methods in the country. To learn more about this campaign and what the HIV combination prevention methods are, let's all watch this.
There you go. Let's all work towards a hashtag Safe for Now Philippines. This campaign aims to promote the usage of HIV combination prevention to ensure everyone against HIV. With the help of our featured hot doctors and hot nurses of Pinas, let's remember the 4 HIV combination prevention methods. Correct and consistent use of condoms and lube, pre-exposure prophylaxis or PrEP, post-exposure prophylaxis or PEP, and treatment as prevention, because achieving an undetectable viral load status means you can no longer transmit HIV to your partner. Nicole, you're on mute.
That's quite a lot of HIV prevention measures, Brian, right? That's why the National HIV Prevention Month give us time to absorb everything. If you're interested, the card flashes on the screen shows the event we've provide for you for this long month celebration. On August 8th, we have Condoms and Lube Day, where we will award the winner of the hashtag Shoot the Rubber PH photography contest. The contest is still ongoing, and you can win as much as 10,000 pesos and other amazing prizes. On August 15th, we also have our PrEP or PEP Day and PEP Day, where we have a webinar to discuss PrEP and PEP all together. We're invited experts to thoroughly distinguish what is PrEP and PEP for everyone's better understanding.
Right. So let me begin with that, Nicole. On August 22, undetectable equals untransmittable, or U equals U Day, where we will celebrate the wins of people living with HIV. And on August 29, culminating activity, where we will have a great game for a fun discussion of HIV combination prevention. But there's more. We will also give free PrEP bottles to more than 30 individuals, good for 3 months use. Just follow and share our page, Philippine National HIV Prevention Month, for updates and details on how you can avail of this limited offer of free PrEP for 3 months.
Wow. Thank you for that information, Brian. We are really talking about delivery of preventive measures here. Moving on, our next segment is a panel discussion to further discuss each HIV prevention method that we've mentioned. Okay, for our first cluster, we will discussing our efforts towards the accessibility of condom and lubricant in the country. Without further ado, let's call on again Dr. Louis Ocampo and Mr. Trio Paras. One of our special guests is all the way from Zamboanga, representing the Mujer LGBT Organization Incorporated, the President and Executive Director. Kindly show some love to Alvin Tony G. Fernandez.
Right. And our next guest is a youth leader and ambassador. Also show some warm love to the chair of Youth Peer Education Network, or YPeer Filipinas Incorporated, Ralph Ivan Samson. Hello, everyone.
Hello, everyone.
Hello.
Hi.
Kamusta?
Hi, Tony G. Hi, Mr. Trio.
Hi everyone. Good afternoon again.
So, Tony G, I think we can start with you. Can you tell us what Mujer LGBT does for people of Zamboanga through the Mujer LGBT Community Center?
Okay. Buenas tardes a todos. Again, konting chika muna about sa Mujer LGBT organization. Yung Mujer LGBT organization, we are based in Zamboanga City. We are the first community center na nag-operate dito sa Zamboanga Peninsula. We are working with different non-government and government agencies. So basically, yung mga services na binibigay namin sa community, isa na dito yung temporary shelter for the LGBTs and PLHIVs. As you can see, yung Zamboanga is the heart of the peninsula. And marami tayong mga PLHIV na, they're far away from the heart of Zamboanga. So basically, we're offering them the temporary shelter where they can stay temporarily. Second, yung psychosocial and paralegal support. So basically, our organization We give psychosocial support po sa mga biktima ng gender-based violence. And also, we provide legal representation if they cannot afford to have one. And lastly, syempre yung free and confidential HIV testing and counseling dito sa community center namin. Yan lang. Thank you.
Wonderful.
Thank you. Wonderful. Thank you, Alvin, Tony G. How about you, Ralph? What activities and services does YPeer offers to the Filipino youth?
Hi again, no. Hi everyone. So basically, Youth Peer Education Network is one of the largest network of youth-led and youth-serving organization working for the advancement of young people in the field of sexual and reproductive health and rights. So we basically pre-COVID time, we provide capacity building for our young people to become aware of their body, especially during adolescent and puberty. But when COVID times, we actually transform our physical training into online. That's why we were able to launch our online response on COVID on ASRH in emergencies. So basically right now, we are able to establish our YPeer University. That's why we still continue to provide capacity building for our young Filipino people. And of course, we believe that SRHR needs should not be stopped even during humanitarian crisis. That's why we also launched the hashtag #GetCondomPH. That's why for everyone who would like to avail condoms and lubricants, you can actually go to bit.ly/condom getcondomph. So it's basically here in NCR, but we are also planning to work with different youth organizations like here who are present to have those free condoms and lubricants na dinideliver sa mga bahay nila.
Right. Thank you, Ralph. That was honestly, I'm hearing all of this, and it's very heartwarming to know all your efforts to really help out the community. So now that we know each other better, let's begin by saying, let's roll down the condom and squeeze some lube and enjoy the pleasures of learning more about how we can protect ourselves against HIV with this method. So would you like to ask the first few questions, Nicole?
Sure, Brian. Let's go to the lighter ones first, okay? Let's talk about some myths and about condoms and lube. Is it true that condom can lessen sensation? Number two, does one size fit all? What does lube or lubricant do? Why do we need lubricant? Hindi ba ito pwede ibenta sa below 18 years old and, sa mga minors? Dr. Lou, Ralph?
Yes, let me answer the first question, Nicole, in terms of whether it decreases sensation.
Mm-hmm.
Well, there is no denying that, latex condoms reduce tactile sensation. However, the experience of pleasure is inherently subjective. I mean, it reflects the complex interplay of sensation, emotion, and cognition. And this is based on a study conducted, but we can actually refocus yung condom promotion campaigns natin to emphasize the pleasure-enhancing aspects of condom use, such as, condom's ability to prolong sexual intercourse. It can also increase, psychosexual tension and ultimately sexual pleasure. So again, it's a matter of how subjective siya. It's a matter how we see the value of condom, and of course yung added value niya of protecting us from sexually transmitted infections, including HIV.
Right. So it's a matter of reframing the aspect of pleasure when it's connected to condom use. Right?
Yes.
Yeah. Thank you, Doc Louie. Ralph, maybe?
Well, sa akin naman, like using condom is just like using seatbelt, diba? Like right now, I grew up in a family na hindi nagsi-seatbelt. But when I go here in Metro Manila, I'm really obliged to wear seatbelt kasi pag may MMDA or like anyone traffic enforcer, talagang merong fine, no? That's why here in Metro Manila, I really use seatbelt. Kahit siguro magpapark lang ako ng kotse or saan ako pupunta. That's why when I go to the province, pag nagsiseatbelt ako, talagang, pag nagdadrive ako, nagsiseatbelt talaga ako. And when my family will ask me, ba't nagsiseatbelt nasa city lang naman tayo, hindi naman tayo naglo-long drive, I always tell them na safety should always our first decision.
Priority.
first choice and priority. That's why siguro using condom is also like using seatbelt. When you kumbaga nasanay ka na gumamit ng condom, it doesn't always necessarily na may sensation man yun o wala. Especially if you love the person and if you want to have sex, why not, 'di ba? At kung gwapo yung kasex mo, mas masarap talaga ang sensation. At kahit na siguro walang condom or may condom, even your hands, when you put it in your anus, there's a sensation. So, I mean, may sensation yung mga ano natin, mga body parts natin. And siguro yung tinanong ni Nicole kanina, no, why do we need to use lube? Because basically for men who have sex with men, like gay people, our anus was not designed for sexual intercourse, but basically if we do have sex, it's okay as long as you use condom to facilitate the penetration, the penetrative sex together with condom, kasi hindi naman ito vaginal sex lang na merong natural lubricating mechanism yung ating mga anal, no. So that's why it's very important the lubricant to increase the sensation at the same time, kasi nga sabi natin may lessen ba yung sensation, but when you use condom na it also add the sensation para mas madulas at hindi siya na-rupture yung ating anal sphincter. And at the same time, pwede ba itong ibigay sa mga 18 years old? Yes, of course. Like with the new HIV policy right now, we have allowing 15 years old into 17 years old to actually access condom without parental consent, and that's very one of our winning battle, no, na young people as early as adolescents should have access to condom and lubricant, because many of our young people right now are engaging sex. In fact, when you go to Twitter, to different platform, you can see scandals of like sexual activities of young people, and we should not be denying, like us young people should have access to this service. We are also human beings and citizens of this country.
Right. Wow.
Tama.
That it's all about safety and that young people are having sex. We can't deny that.
Exactly.
Right.
Exactly.
I'm curious about maybe Mr. Trio or Tony G. Any inputs, perhaps? Okay. So I also want to know, how are we making condoms and lube an exciting HIV prevention method, especially that it's been there for quite some time now? I'm curious, maybe perhaps Mr. Trio or Tony G can answer this question.
Well, for me, I guess if you go into a convenience store, you'd see a lot of varieties of condoms, like regular condoms, condoms with different scents, condoms with which gives you different sensations, like dotted ones or spiral ones. I guess this is what's making it more exciting or appealing to those people who are using it. There are even condoms that glows in the dark. So like imagine you using that kind of condom. It gives you a different kind of feeling, or maybe boosting whatever that's that needs to be boosted during that time, maybe.
So condoms come in different textures and experiences, sensational experiences that make it more interesting.
Yes, it does. For me.
Yeah, definitely. And it's glow in the dark condoms. That sounds like fun. Tony G, perhaps?
Yeah, and also yung condoms ngayon, may flavors na, no? May flavors, may strawberry, chocolate. So I think that's more inviting na sa ating mga key population to access that condom. And yung condom ngayon, ano na siya, have evolved to the thinner materials that feature, various textures and lubricants that increase ng pleasure while providing ultimate protection. And I think mas maging exciting din siya and challenging as well if the government is willing to procure a much thinner condom next to the skin. Diba? Para more level up na tayo.
I agree, Tony. I agree to Tony Gino. Dapat talaga kasi one of the reasons also na yung iba siguro, it could be they are not used to use condom. It's because the existing condoms right now are very thick. But basically, for those persons who can afford to buy, there's actually a thinner condom, no? But what we want right now is our government should provide a much thinner condom for young people, especially young people who cannot buy condoms, but wanted to have sex with pleasure. So we have to have that kind of condom right now.
Correct. Then maybe it will be more exciting.
True, I agree.
And if I may add, Brian, I think we need to repackage condom as a prophylactic device for sexually transmitted infection rather than yung ating old paniniwala na it's just a contraceptive commodity. And another thing is, we need to teach young people to use condom at the very early age. Looking at the statistics that we have, majority of our 15-year-olds are already engaging in sex. But unfortunately, they learn how to use condom at the age of 18, for example, and it's too late. They're already exposed, to sexually transmitted infections, including HIV. So we need to teach condom at the very, very early age, as early than when the sexual debut of 15 years old.
Right, and which brings me to the idea of what's preventing people from actually talking about sexual health and proper practices at a very young age. So which brings me to Nicole.
Yeah. So, Doc, I habol ko lang kanina. Kasi meron tayo, di bang, sizes ng condoms? Is it like one size fit all, yung condoms na available?
I think si Ivan ang gusto kong sumagot dyan kasi, yung kanyang mga members are young people. And young people would have, different sizes, particularly as a grown-up adult. So, Ivan.
You put me on the spot, Doc, but basically, I really wanted to answer that question. Well, basically, there's so many sizes of condom. Like if you go to other YP, because YP has also present in more than 52 countries, we actually have different sizes of condom, like for Arab regions, for the Middle East regions, no? So that's why very important then to know the sizes. Like if you were able to buy condoms in Bangkok, for example, it's not actually the same condom what we have in the Philippines. At maganda din na yung mga bata ay meron silang kakayahan na magtanong na paano ba gamitin yung condom, meron bang mga sizes? It's because sometimes young people would just use condom without even asking or have the correct information. But basically, condom has different sizes din. May mga mahaba, merong malalaki. But for the Philippines, very important na Philippine condom talaga ang gamitin natin. Maliban na lang kung ducks talaga kayo na sobrang pang Canadian, American sizes ng mga condoms, no? Pero different condom have different sizes.
Right, like parang magnum, condom.
Yeah. May XSM, ganun siya.
And I think the whole topic of preventing young people unable to talk about condom size, unable to talk about condom use properly at a very young age brings us to our next question, which I think Nicole will be asking all of you, all of us.
Yes. Na sabi nga kanina ni Sir Ralph na parang sa Thailand, di ba? It's normal for them. But here in the Philippines, we all know that our country is very conservative mindset. So, paano natin siya ma-open yung topic about sex, about condoms? And, di ba, normal naman na pag bumili ka ng condoms, iba agad yung tingin sa'yo ng tao. When in fact, gusto mo lang naman talaga magkaroon ng protection para wala kang infection or unwanted pregnancy, di ba? How are we dealing with this? And do we already have a policy? Doc Louie, Tony G?
Okay. Right now, we don't have a national policy yet, but again, it's good that we already revised the national HIV strategic plan because it's very specific. Specifically mentioned that the country should have a national policy on condom. So hopefully in the next few months, siguro medyo na-delay lang yung ating mga activities because of COVID, but I'm sure once this pandemic is over, we will be, studying on the development of the national condom policy. So there. Thank you, Nicole.
Dagdag ko lang, Doc Louie, no? I mean, like, we don't necessarily create another policy on changing the mindset of young people or any like parents, because the existing reproductive health and rights, or yung ating RH law, has specific provisions on the right, providing the right correct information among adolescents. That's why we are closely working with the Department of Health, adolescent sections, at the same time with the Department of Education for the implementation ng comprehensive sexuality education. And in fact, CSE should be implemented as soon as possible. Kung wala lang COVID, dapat meron na tayong CSE sa mga curriculum natin at naka-integrate ito. In fact, CSE are being taught as early as kindergarten, like teaching children what is the good touch and the bad touch up until senior high school, no? Kasi dapat, if we really wanted to break the stigma, break the conservative mindset of Filipino, we need to teach the children and young people at the very early age talaga. That's why I hope that the Department of Health and the Department of Education will continue to push through for the implementation of comprehensive sexuality education, even during this pandemic blended learning strategy ng DepEd, no, dapat kasama pa rin yung CSE talaga.
Right.
Yeah. And can I add? And also, no, I think kailangan din natin dalhin ang usaping sex sa bahay. I mean, ayaw natin pag-usapan yung sex kasi hanggang ngayon tabu pa rin siya. And even sa school, tama yung sinabi ni Ivan, even sa school, ang pagtuturo tungkol sa sex, parang ganun pa rin yung pepe at titi nagsama, magbuntis ka. Pero hindi natin level up, elevate ang conversation na kapag ang pepe at titi nagsama na walang protection, pwede ka makaroon ng infection. So yeah, we have to break the silence and change the around sex and HIV, and let's deal with it openly. Kasi hindi lang siya problema ng mga health sectors or ng mga health advocates. Ito ay problema natin lahat. Problema ng nanay, tatay, ng anak, ng kapatid. So let's get involved in the problem.
Right. So the implementation of policies and education can help us break the stigma when we discuss about sex, and also to diversify the conversation of sex beyond just reproduction. Now, one question that I have here is, where can we get condoms and lube? Is it even given for free? And why is it important for adolescents and young people to access condoms and lube? And another question, why do we need to invest in prevention among key populations, including the youth?
Ako na sasagot, charot. So basically, where to access condom? In fact, all our local government units, yung mga LGUs natin, whether RHUs or city and municipal health office, are actually mandated to create or establish adolescent-friendly health facilities. And right now, we have around 30 level 3 adolescent-friendly in the entire Philippines, and other LGUs are working so hard pre-COVID time to actually establish level 1 and level 2. So basically, if you're a young person in your cities or municipality, you can actually go to the city health office and look for the adolescent-friendly health facilities. And maybe kung hindi man ready yung local government units or yung mga young people, hindi sila pinapansin ng ating mga city and social welfare offices, no, kasi baka wala ding training, hindi pa ganun ka-open. Our community centers, which are actually funded by the Global Fund to Fight AIDS, Malaria, and Tuberculosis, and in partnership with Love Yourself, are actually giving free condoms together with our member organizations all throughout the countries. In fact, we have more than, I'm not sure how many community centers, but there's around 17, right? Community centers who you can access. And at the same time, yung ating question ay free ba ito? Yes, it's free together with the lubricant. And in fact, the hashtag #GetCondomPH, including the delivery, is for free. I forgot the next, the other question about the, again, sorry, yung isang question.
Pa-up lang ng slide. Yeah. So
why do we need to invest
in prevention among key populations?
As presented by Duke Louie a while ago, no, like bulk of the new infections are coming from the 15 to 24 years old. And if we don't provide the right and correct informations, including the services, not just giving information, but including the services, we will keep on counting new infections per day. So if we really wanted to ensure that our young generations, our young key populations are protected from getting HIV, we need to provide the services, and one of which providing condom. But we cannot always say them stop having sex. Kasi many people would argue na, para hindi maging HIV positive or hindi ka mahawa ng HIV, do not have sex. But basically, not all young people can stop having sex because they have other needs, like young people engaging into sex work, or young people who are sexually abused inside the house, or young people who are injecting drug users, for example. So, ang daming mga situations na mga young person that put them at risk without even providing them services.
Right.
Just want to add, Brian, we need to invest, to these interventions, considering that we have limited resources. I think we need to focus yung ating investment to the key populations, which, sabi nga ni Ivan, comprise, the more majority of our new infections. So, investment to run the programs is very critical. So kailangan natin ng pera, or else we cannot run programs.
Right. Thank you.
At I mean, mas mahal yung treatment compared sa prevention. Like if you try to calculate how many young people living with HIV who are taking ARVs for life compared to providing condoms for them not to get infections, that's quite a big difference in terms of providing or investing budget from the government.
So invest in the most impactful population where the efforts will be most felt and is most needed. So thank you. Nicole?
See, Theo, do you have something to share for Theo?
Well, I would just like to really emphasize the work of investing in terms of the creation of an HIV responsive generation, and also the realization of having an HIV generation. Maybe comment all, right?
I see. Well, I think we know about condoms and lube now, diba? Mas mas educated na tayo. And thank you to our guests, Ralph, Tony G, Doc Louie, and Theo will stay with us for the next topic. Okay. In the meantime, if you want to know more about condoms and lube, you can follow us on the pages of our guests and other details and information about this method.
And towards the end of the show, all our guests will join us for the Q&A segment. If you have any questions in mind, we invite all our viewers to comment down below, and we'll answer as many as we can. And for those who just tuned in, this is the Explainer, the National HIV Prevention 2020 Kickoff towards a hashtag #SaferNowPhilippines. This event is presented to us by SKIPA Philippines and Champion Community Center, sponsored by the Rotary Club of Cubao, QC District 37A.
The National HIV Prevention Month 2020 is also brought to us by Durex, Leve, 3M, Please, and supported by UNAIDS, AIDS Healthcare Foundation, Filipina Shell Foundation, Inc., the Australian Federation of AIDS Organization, or AFAO, APCOM, and Love Yourself, Inc.
Hi, I'm Catering Gray, your Miss Universe 2018. Love Yourself, a community dedicated to empowering one's self-worth, introduces Red Filipinas, a new way to prevent HIV. Yes, you heard it right. Prevent HIV. How? Through a daily pill called the pre-exposure prophylaxis, or simply PrEP, which enables your body to resist HIV by more than 90%. PrEP is FDA approved, although we advise to talk to your doctor
adds another layer of protection to feel safer and more empowered against HIV. But remain consistent with the use of condoms and lubes, since PrEP does not prevent any other sexually transmitted infection. But with PrEP, you are better in control of your sexual health by preventing HIV. So prepare yourself and see a doctor. PrEP Filipinas is out and available, because with PrEP, you are ready to be safe.
Thank you, Queen Kat. That's a sweet and short note about our next topic. Earlier, we talked about condoms and lube, but alongside this method, we can add more layers of protection against HIV with the use of PrEP and even PEP. Our next topic is kind of medical and technical, but we will make it as light as possible. And don't worry, guys, because by August 15, we will have a more in-depth discussion on PrEP and PEP.
Now you may be thinking, what is PrEP and PEP? PrEP stands for pre-exposure prophylaxis. It's simply taking a daily pill to reduce the risk of acquiring HIV before being exposed to the virus. On the other hand, PEP, or post-exposure prophylaxis, is immediately taking antiretroviral medicine to reduce the risk of acquiring HIV after being exposed to the virus.
Right. And to help us further understand what PrEP and PEP are, let me call once again, Doc Louie and Trio to be part of our panel. And let me introduce the Executive Director of One Positive Movement Association, which operates the Lacan Community Center and Primary HIV Clinic in Pampanga. Please welcome Lester Sibuga.
And our last guest in this panel is a 10 Outstanding Youth Person in the World awardee in 2018, and the founder and executive director of Love Yourself Inc. Show some love to Ronavine Pagtakhan.
Hello.
Hello, everyone.
Hi, everyone.
Hello. Hi, Vin. Welcome back, Doc Louie, Trio, and hi, Jen. So let me first ask Lester, what does One Positive Movement and Lacan do to promote PrEP and other HIV prevention measures in Pampanga?
By the way, good evening po sa lahat ng viewers natin. So, we do promote PrEP through. So, by the way, magandang gabi sa inyong lahat. Okay, Lacan Center offer PrEP, and mostly we do promote PrEP through social media campaign. And during our outreach activities in the community, we introduce PrEP as an HIV prevention method. Okay, and also once our client tested or screened negative, we offer PrEP to them.
Right. Thank you.
What about Love Yourself, Vin? Can you quickly guide us through the services of the organization, especially on HIV prevention?
Well, Love Yourself offers combination prevention, and basically we follow the idea of continuum of care approach. So basically we offer combination prevention and treatment. So in Metro Manila, we have 5 community centers, 1 in Cebu, 1 in Cavite. We partnered with 3 private clinics, and we currently have 17 community centers that we're supporting. And all of those offer prevention and treatment for sexual health services, STI, HIV, hepatitis, A, B, C referral. We also do trans health programs, SOCI, SC. We have a new program called Flourish by Love Yourself that promotes mental health. I'd like to say hi to Miss Clea, our favorite host. And also, we have programs on PrEP and PEP that we demonstrated in the country so that it's now currently being scaled up and replicated. We also have safe spaces, the providing increase in accessibility of condoms and lubricants. We also have projects like Love Yourself Caravan, wherein we go to companies and universities and offer them HIV in the workplace policy, awareness campaigns, and on-site testing. And also, very recently, I think 3 years ago, we started our treatment program. And from, I think, 5-10 clients, we currently have the second highest number of enrollees in the country. We have 7,300 clients enrolled in the treatment program. And I'm happy to share with you guys that almost 92% of all of those clients who have been on ART post 1 year and who are eligible for viral load testing are virally suppressed. And we were talking about undetectable equals untransmittable. So 92% of our clients are untransmittable and they can live happily, normally, and have sex and fun.
I love
and a
that.
relationship, of course.
Thank you, Vin, and thank you, Lester. Before beginning this session's deeper discussion, let's all swallow and never spit our happy and emergency pills, which are PrEP and PEP, so that we can be safer from HIV. So when I hear about PrEP, here are some of the questions that quickly come to mind. What is PrEP? Who can use it? Is it safe and effective? And how much does it cost? So I'm inviting perhaps Doc Louie and Lester to answer.
Yeah. Okay. Thank you, Brian. As mentioned by Nicole kanina, yung PrEP stands for pre-exposure prophylaxis, and it is a pill for those who are negative for HIV. So it's a protection. It's another layer of protection for those who have high risk behavior. Okay. So it's a daily dose, and we also have another regimen now that we call event-driven or demand-driven. Na parang iinumin lang 2 hours and 2 hours before, 2 to 24 hours before the actual sex. And then the 2 pills, and then 24 hours after that, you take another one, and then 24 hours after you take another one, and then you're safe. Okay, and it has 90%, more than 90% protection efficacy. So ibig sabihin, mataas ang chance na you will not get the virus if you are taking this pill, on a regular basis. Now, another good news, we are now finalizing, the government, the country is now finalizing the national guidelines for PrEP. And by 2021, through the Global Fund grant, we will be expanding or scaling up in terms of the number of clients who will be provided with PrEP for free. Okay, so, but of course, now, since wala pang national investment, then it's for a fee. But Vin can tell us more about how much is it, and of course may price range naman in different access points.
Right. Thank you, Dr. Wee. Perhaps Vin or maybe Lester can answer some of the other questions.
Okay, I can answer about the price. So we did a demonstration project on PrEP. So we brought PrEP in the country together with UNAIDS and WHO and RIEM. So we still have clients who are having free PrEP. So we have around 300 of them. And then we have around 1,200 who are enrolled in our paid program. Because since the government is not procuring PrEP, but since we are a private institution, we can dispense PrEP, right? So we're offering it at a cost of 2,400 for their, 2,000 pesos for their enrollment, and then 1,500 for the next pills.
Right.
And also,
yes.
You go ahead, sorry.
No, go ahead, Vin.
So for PEP, it's not also purchased by the government. So we're purchasing it from the supplier and we're offering it at 2,400. Now, PEP is just like PrEP, di ba? You take it prior to exposure. Ito naman, the PEP is taken after you're exposed. Kasi di ba, sometimes merong mga emergency na nagkaroon ng ejaculation inside, o kaya naman yung mga sad stories of stealthing. I don't know if you're familiar with stealthing, but stealthing is yung kunyari nagsisex kayo ng isang partner mo. Tapos, ang agreement nyo ay magko-condom kayo. Pero in the middle of the sex, biglang pinull out ni partner yung condom. In other countries, it's actually an assault. But here in the Philippines, it's not really talked about, but it's a problem, yung stealthing. So yun, pag mga ganong cases or pumutok yung condom, yun, pinopromote natin na yung client can access PEP naman. Now, in order for them to access PEP, they can just visit www.go.loveyourself.ph/PEP. Tapos ang process nun, they will get tested first. And Love Yourself is a RIVDA accredited institution by DOH and SACL. So immediately the same day, the client gets their confirmatory result. We just got our accreditation last week, Doc Louie. So we're very happy to share that. So after nun, the client, if the client is negative, then we can provide the PEP. The PEP is taken for 1 full month. So it's 1 bottle with 30 tablets. It's basically the same as PrEP. Kaya lang ang PEP, 2 tablets siya. Yung PEP na gamot plus 1 other more na ARV. Ganun siya.
So I'm noticing that PrEP and PEP, that bottle that's given, that 2,000 or 1,500 for the next bottle, that's for 1 month. Right.
Yes.
Okay. And I think one other question that I'm wondering about the panel, if you can answer, who can use PrEP, and is it safe? Is it safe to use? That idea, safe ba siya? Who can use it?
So let me answer that first part. Who can use PrEP? Actually, lalaki, babae can use PrEP as long as, or pwede rin gumamit yung mga, or kung meron kang sexual partner na person living with HIV na hindi pa siya virally suppressed, they can actually use PrEP. And if you think you had unprotected anal, vaginal, or neovaginal sex for the past 6 months, you can. And also, if you have a multiple sex partner, and sa tingin mo hindi ka gumagamit and high risk ka to get HIV infection, you can use PrEP. On the studies, 90% of the PrEP user is being protected by PrEP.
Okay, maybe just to contextualize the answer of that. No? So primarily, PrEP can be used by anyone who's interested of adding an extra level of protection. Now, if you are going to ask, is it safe and effective? I would answer yes. Why? Because it's FDA registered, so we can guarantee that the products that we are providing is indeed safe. Okay. As for maybe the price, I would agree with Ronvin. The price varies from 1,500 to maybe 2,400. That's for us here in Central Luzon. But maybe, yeah, it really varies.
Iba yung presyo sa ibang lugar outside of Central Luzon.
Yes.
And Tito Bri, also, I'd like to mention that even private doctors, you just check online. We have, I think, 20 doctors who are offering PrEP sa buong NCR, Metro Cebu, and I think also in Davao. Kasi it's available naman with private doctors. The only concern lang naman is that wala pa kasing guidelines na nilalabas ng Department of Health. But they're doing it already. We actually are finalizing it already. So kasama ang communities. So napakaganda. Kasi nga, ano siya, it's not just about one person talking. It's about the whole community na nag-uusap kung para kinino at paano natin maibibigay ang PrEP sa mga tao. So, ayun, may mga doctors na nag-offer.
Brian, I just want to add, no, I agree with Vin, but I think right now we really need to scale up yung prep sa bansa natin, considering that very low yung condom use, among particularly for MSM, and this is a game changer actually to really decrease, the number of new infections. So because still based on our survey conducted in 2018, ang baba pa din kasi ng condom utilization natin. But of course, I want to say that PrEP is not a magic pill for all sexually transmitted infections. This is specific for HIV. So, and that's why, again, a word of caution that, PrEP would not prevent other sexually transmitted infections aside from HIV. On PEP, I would like to say that may golden period yung pagtitake. Dapat, if you're exposed, you need to take PrEP within the 72-hour period to be for that drug to be effective.
So may window period din. Okay. Yeah. So what I'm hearing is PrEP is safe. It's effective. It can be used by anyone who is sexually active or desiring to actually protect themselves. And it's needed because the population of the Philippines is not really high in terms of adherence to condom use. Right. Okay, Nicole?
Well, everything naman na napag-usapan na natin, sobrang natulala na lang talaga ako kasi sobrang grabe yung information na-absorb ko din siya about PrEP and PEP. Kasi, di ba, hindi naman lahat well-educated about PrEP and PEP. Most of our clients or people are asking about PrEP kasi nga nakinig na nila abroad, but now we've been fully educated about it. Alam natin kung saan natin siya makuha yung presyo, kung kailan natin siya i-take, at kung ano yung dapat nating i-take sa kanya. One quick question lang po. Ano pa siya, ang PrEP and PEP, pwede ba siyang ihalo sa ibang vitamins like me? I'm a transgender woman. Yung mga trans sisters natin na nag-take ng HRT, is it safe for them to take PrEP and PEP as well?
That's why meron tayong tinatawag na mga pre-PrEP laboratory tests. Kaya, di ba, kung mapapansin mo, karamihan ng mga doctors at saka tayo, yung unang punta ng client natin, i-HIV testing natin yan, pagkatapos mag-undergo yung client ng mga series of laboratory tests para malaman natin, kunyari, healthy ba ang liver ng client or baka naman merong potential na issues na mag-arise kaya hindi pwede yung hindi pwede yung PrEP or pwede yung PrEP. Pero most of, we have clients who are transgender people pero they are okay naman with PrEP.
Yeah. Brian, I'm happy na bring up din Nicole yung issue na yan kasi it's a myth, but it's a valid concern among transgender women. But based on studies, wala pong effect yung ating hormone replacement therapy with antiretroviral drugs, including PEP, PrEP, and even the treatment for HIV. So, it can be safely taken if you're also taking hormonal replacement therapy.
Right. Thank you, Dr. Wee and Vin. So there's no it doesn't conflict with hormone therapy for trans individuals. Right. Thank you. I think we're going to so for the next question. Okay, what are the prerequisites in initiating PrEP? Can we elaborate on how PrEP should be taken? And what's an on-demand PrEP routine? Should people on PrEP have the freedom to disregard condoms and lube? I think na-discuss na kanina to ni na yung PrEP, hindi naman for all sexually transmitted infections, right? It's really targeted towards HIV prevention. Now, I think next.
Para lahat naman na natakal na natin dito sa PrEP and PEP talk natin. Well, thank you again sa ating mga guests, Brian.
So that was a very, for me, very informative and enriching session where I think me and Nicole were learning as we were listening to all of you. And I learned a lot about PrEP and PEP. And I just want to say thank you to our guests, Vin, Master, Dr. Lee, and Trio. And they will stay on again with us for our last clusters discussion and Q&A.
But if you want to know more about PrEP and PEP, you can follow us on the page of our guest for other details and information about this method. You can also join our PrEP and PEP Days webinar on August 15 at 5 p.m. on this same page.
And again, I will remind everyone that all our guests will be called back for the Q&A segment. So please comment with your questions below and we'll answer as many as we can later on. For those who just tuned in, this is the Explainer, the National HIV Prevention Month 2020 kickoff towards a hashtag Safer Now Philippines. This event is presented to us by Kickoff Philippines and Champion Community Centers, sponsored by the Rotary Club of Cubao, QC District 3780.
The National HIV Prevention Month 2020 is also brought to us by Durex, Duvet, 3M, Bliss, and supported by UNAIDS, AIDS Healthcare Foundation, Filipina Shell Foundation, Inc., the Australian Foundation of AIDS Organization, or AFAO, APCOM, and Love Yourself, Inc.
But wait, partner, before we proceed with our panel discussion, let us all first hear from Dr. Yugang Bao, the Deputy Asia Bureau Chief of the AIDS Healthcare Foundation, to give us a message of support.
On behalf of AIDS Healthcare Foundation, I would like to congratulate the initiation of Safe Now HIV Combination Prevention Campaign today. This is a milestone on HIV prevention history in Philippines, and the Philippines is the first country in Asia to start the campaign. AIDS Healthcare Foundation put HIV combination prevention as one of our priorities and advocate all the country focus on HIV combination prevention. We are willing to work together with different stakeholders for the end of HIV/AIDS in Philippines. Thank you very much.
Thank you, Dr. Bao. AHF Philippines has been a key partner providing prevention, commodities, and support testing and treatment services in social hygiene clinics, treatment hubs, and community centers across the country.
Right. And just to have a quick recap, we already learned so much about the HIV landscape in the country and at the regional level through Central Luzon. We've also discussed the importance of correct and consistent use of condoms and lube. And we explained the difference between PrEP and PEP and why we need these medications to increase our ability in defending ourselves against HIV.
Thank you for that quick recap, Bri. This time around, we're going to talk about this new concept in the country, that when you are PL-HIV regular taking medication, and you have reached the undetected level of virus on a certain test, then the virus is now untransmittable via sex.
Right. And now to discuss more about treatment as prevention, may I call in again Dr. Luis Ocampo for us to be joined by our special guest, Roberto Figuracion Jr., the Community Center Officer of the Raja Community Center by the Iloilo Chapter of the Family Planning Organization of the Philippines, and Iko Johnson, founder and president of the Project Red Ribbon Care Management Foundation Incorporated. Welcome, Roberto. Mr. Roberto and Iko, hello.
Hi, rainy evening to everybody. So thank you for inviting us.
And thank you.
Hi.
Right. So I guess first off, I'm curious to know about what FPOC Iloilo is doing for the PLHIV community in the Visayas, particularly in Iloilo.
Hi, mayong hapon sa lahat ng nakikinig. Sa FPOP Iloilo, particularly yung Raja Community Center, ay nag-offer ng one-stop shop na solution para sa persons living with HIV. No? We started as a testing facility, but eventually we invested to make sure that that the clients that we diagnose can already avail treatment services at FPOP Iloilo. So we also make sure that isa sa mga importanteng magawa ay na ma-maintain na nasa treatment pa rin ang mga persons living with HIV na na-diagnose. And we offer a range of services na hindi lang nakafocus sa biomedical na approaches and needs, but we even have 2 social workers to ensure that the psychosocial needs of persons living with HIV ay na-address natin. Kasi kadalasan yun yung mga concern why people are not staying on treatment. Not purely medical or biomedical reasons, but dahil biglang nag-stop, dahil nagka-problema sa jowa or sa family, or nagka-problema sa finances. So we look at things in a very holistic and integrated approach. That's why we have a wide range of team and partners that we work with to provide all these services to the community in Iloilo.
Thank you. So it's a holistic approach to helping out and aiding PLHIV communities. Thank you.
Tama. And for Red Ribbon naman, what is a notable program or project for the PLHIV community that you can share with us? Because I believe you have a program for indigent children living with HIV, right?
Right, Nicole. Thank you very much once again, thank you very much for inviting me. Project Red Ribbon's thrust is to improve the quality of life of people living with HIV through treatment, resources, awareness, care, and support. Now, you have mentioned one of our core programs, the Duyan, Cradling Children with HIV. And you are right, we are helping them improve their quality of life by providing them with assistance when it comes to treatment, medical assistance. We have been providing them with financial assistance by giving them transportation assistance to and from the hospital. We have been providing them with medicines, milk formula, vaccinations, and school supplies. And last year, we have started our livelihood assistance program for the families of the children. What we want there is that our children remain to be healthy until they reach 18 years old. Since Duyan is really focused on infants to 17 years old. And but aside from the Duyan program, we have been assessing also the youth, people living with HIV, so that we can provide them with a thorough assistance, because our goal is our approach is a holistic approach, because we just don't believe in treatment. You can provide our system with treatment, but when it has to be addressed holistically. There are issues that we have to address. So Project Red Ribbon crafted programs in order to address this issue.
Tama, galing. Kasi, di ba, kailangan din natin maging focus sa mga bata na affected din ng HIV.
Yes. So, thank you, Iko and Roberto. So, yung tanong ko is, what is undetectable equals untransmittable, or U equals U? Ano yung concept na yun ba? What's it all about? In the panel, enlighten us as to why HIV treatment is now an accepted prevention method.
Sige, I'll answer that, Brian. As you mentioned, undetectable is equal to untransmittable, meaning if your viral load is already low, you cannot transmit the virus anymore, okay? But this concept requires several steps, and it will should start from testing. because we cannot, if we don't diagnose them, then we cannot start treatment, right? So it goes back to the testing coverage that we have. Since I mentioned earlier kanina na we already have an estimated number of 111,000, but we're only testing about 70%. So may leakage pa doon. So we need to diagnose everyone and start them on treatment. Doon sa second 90 natin, mababa pa din. Like out of 70 diagnosed, we only started treatment around 40,000. So may leakage tayo na around 30,000 people that we need to start on treatment. Now, once they start on treatment, they need to adhere to the regimen. And that means they have to take the drug, the antiretroviral drug, every day, okay? And in few months, like 1 or 3 months after the initial pill, doon pa lang magkikick in yung gamot, and then the function of the antiretroviral drugs is to stop the replication of the virus in the system, in the blood, in the body. So doon pa lang magiging undetectable. And again, there's only one way to know if you're undetectable already, and that's by doing a viral load test that I mentioned earlier na medyo mababa pa yung coverage natin. Around 17, by the end of 2019, nasa 24% pa lang of those who are on treatment are virally tested. So I think we need to do, those steps para ma-achieve natin yung treatment as prevention para maging effective siya. But this is a very effective strategy.
So it starts with testing, then to adherence to medication, and then to testing with the viral load testing to determine undetectable levels. It's just that process, right? Thank you.
That's something.
Yes, Ego.
Okay, so for all our viewers, let's define what viral load is. So viral load is the amount of virus one has when one has HIV. And like what Doc Louie has mentioned, this can be detected through the viral load test. So this is one of the laboratory tests being prescribed by the infectious disease doctor in all the treatment facilities nationwide. Now, to make sure that this is very, very effective, there are 3 criteria that one has to have. Number 1, the client or the person living with HIV should be on antiretroviral therapy. Number 2, the person has to be undetectable, meaning the amount of virus one has should be undetectable level. Sometimes ID doctors would say the person should have undetectable levels for 3 months. Some would say 6 months to make this effective. And number 3, the client or the person living with HIV should never miss or skip antiretroviral therapy. So this is very, very important. So Project Red Ribbon stresses this, the importance of taking antiretroviral regularly. Because number 1, he would be protecting his health. He will be healthy even though he has HIV. And number 2, it becomes a responsibility because HIV stops with him or her. So it's a societal responsibility. And in that way, we can stop HIV.
Wonderful. So it stops you, right?
Yes. Sorry, Brian. I would just like to maybe add more information about U is equal to U. So basically, it's just a description. U is equal to U. This happens when a person takes ARV. So the process is that it lessens the viral load of a person living with HIV kapag nag-take siya nito, and then it delays progression to AIDS condition. Okay, so as you go along with your treatment, so what happens is that you reach a certain level wherein yung blood mo becomes undetectable. So kapag undetectable ka na, you're also untransmissible. Okay, so that's what's making it preventive in nature. Okay, I would just like to maybe emphasize also the importance of ARV adherence for our clients. It's not just viral load testing per se. It's also important that we emphasize or encourage our clients to also be very adherent to their ARV medication.
Thank you, Trio. Thank you, Iko and Dr. Lee.
Thank you, thank you. So, ano na tayo na alam na natin kung paano yung ARV works, di ba? Yung undetected stage or level, meaning untransmittable. So, my next question to our guest is, so paano naman yung partner nila? Siyempre, ang tao, kailangan din ng partner, di ba? Should we advise them or encourage them to wear condoms or take PrEP for the partner who is negative or, HIV negative? Paano natin sila mapuprotektahan on their life para masaya din naman sila, yung sex life nila is masaya din?
I think I'd like to answer that, Nicole. No? That's why we're promoting combination prevention right now. This is a very good example where there's a zero discordant partners. Yung isa HIV positive, yung partner niya negative. So, ang sinasabi natin, pag undetectable na yung viral load ng taong may HIV, maliit na yung chance na maipasa niya sa kanyang partner, no? So that's clear already. Pero we also encourage, as mentioned earlier, na kahit nagte-treatment yung isang tao, they can still they can opt to use condom pa rin when they sex with their non-positive or mga HIV negative na partner. Kaya sinasabi natin na combination kasi nga ini-encourage natin na tuloy-tuloy yung pag-inom ng gamot para mababa yung chance na maipasa niya sa kanyang partner. Pero pwede pa rin siyang gumamit ng condom para may additional protection pa rin na as mentioned by Dr. Louie kanina, hindi naman lahat ng STI kayang i-protect sa PrEP. So ganun din naman pag nagagamit ng condom, mapapababa natin yung chance na makakuha rin ng mga ibang STI yung person living with HIV if gumagamit ng condom. It's really all about how the partners or how the sexual partners will decide ano yung best na prevention na option para sa kanila. So pwedeng nagpe-PrEP yung HIV negative, tapos yung HIV positive continues sa pag-inom ng kanyang ARV treatment. That's very good combination, no? At kung gagawin pa sila ng condom, better. Parang wala na talagang chance na mahawa yung HIV negative from the positive na partner. Pero isipin din natin na ang lahat ng ang mga sexual encounters dito sa Pilipinas, hindi lahat nasa konteksto ng relationship. Meron talagang ibang mag-partners na one time lang na sexual contact, no? So they don't even have the time to discuss things like that, or there are even possibilities where persons living with HIV who are effectively on treatment, and ang sabi nga ni Iko, undetectable yung viral load, may not even discuss this in detail with a partner. So, okay pa rin na nagko-condom yung negative or yung tao na hindi niya alam yung current niya sa status na baka positive siya or negative. So, this is the beauty with what we are promoting on this particular month, no? Na meron palang iba't ibang paraan para encourage natin na mababa ang chance na mahawaan ng isang tao ang isang tao ng HIV. Kasi combination prevention talks about kahit HIV positive ka, na mababa yung chance mo na makahawa, pero kung gumagamit pa ng condom, mas bumaba lalo or almost wala nang posibilidad na mahawa ka, or kung gumagamit ka pa ng PrEP. Kasi hindi naman lahat ng tao, at gaya na sabi ni Dr. Louie kanina, ay gumagamit ng condom. May chance na gumamit ng condom or may available na condom during that casual encounter na mabilisan lang. Nagkatinginan lang sila sa MRT, biglaan. But if they're on PrEP and the person who is HIV positive is on treatment, then effectively there's no chance of getting the infection. So yun ang kagandahan ng combination prevention.
I just want to add, Brian. I mean, I agree doon sa sinabi ni Robert. But for serodiscordant couples, for example, who are in a more exclusive relationship, let's say heterosexual, partners who want to have kids, for example, this is a perfect solution because by being undetectable, they can now not use condom because they want to have kids. So I think this is the perfect solution for those heterosexual serodiscordant couples na gusto magkaanak, for example. So yon. Yes, Iko, you were saying something.
Okay, so just to add to that, this is the scenario. There are different strains of HIV in the Philippines. Kaya nga different lines of therapy tayo. May first line, second line, third line. What if I'm undetectable and I'm having FUBUs or I'm playing around, no? And then all of a sudden, I didn't know. Siyempre, pag nakikipag-sex, most of the time, you don't ask the man if what his HIV status is. No? So what, just in case, the person that you have sex with is also a person living with HIV, and then he is taking a different drug or different HIV medicine. What if he has a different strain? So there's a possibility, there's a chance that you might get a different strain which is resistance to what you are taking, what ARVs you are taking. So there are instances in the community where biglang tumataas ulit yung viral load niya because nag-resist na yung medicine or yung medicines niya hindi na effective dun sa new strain of virus. That's the reason why the community and different organizations are still promoting condom use. Like what Doc Louie has mentioned, kung serodiscordant kayo, kung exclusive partnership, so this is perfect. This is a perfect scenario. But then when it comes to you, now you are free. Now, meaning you can hang around, you can hook up anywhere, tapos without even knowing what's the HIV status of the person. That's no?
Right. So, what I'm hearing...
To tell everybody, if you are...
Right. Thank you. What I'm hearing is that all the different methods, the combination methods that we can utilize to prevent HIV from spreading, from having further infections, we can use them and put layers upon layers of protection. And that for individuals who are undetectable, it is a process from testing, then to having adherence treatment, and then finally to really getting tested using a viral load specific kind of testing. And it's all about these different factors that can help prevent and stop the spread of HIV. And that's where it comes in as a prevention method. So for those who just tuned in, we are discussing the different HIV combination prevention methods available in the country. We have covered condoms and lube, PrEP or pre-exposure prophylaxis, PEP or post-exposure prophylaxis, and HIV treatment as a prevention method because undetectable equals untransmittable. So let me also remind you that we will be having a undetectable equals untransmittable U equals U day on August 22, where we will talk about the wins of the HIV community. What's in store for us, Nicole?
We unveiled all the combination prevention measures. For us, many of you just got information overload, diba? Maski rin naman ako, medyo na-overload na rin ako. So to help us manage the information and able us to link the facility for access to these methods, our National HIV Prevention Month team has tied up with Safe Space PH team to entertain our questions about HIV combination prevention, and we're to access these preventive measures through the innovative chatbot system on the messenger. To walk through us, please watch this. Safe Spaces page started as a project for condoms and lube distribution with the help of the LGBT-friendly establishment to serve as a safe spaces for one's sexual health and aid by digital tools. But now we are reinventing it to become more inclusive of new ways to prevent HIV and make it as interactive as possible so we can reach and educate more. So please go to the Safe Spaces PH chat box system, check on it, play around, and if you find something that you can that you think you can improve on, please do hesitate to give us a feedback.
And I will definitely check that out later after the show. That's Safe Spaces PH. You can follow them on Facebook, and we will all link our materials to that very innovative chatbot system. So it's as easy as clicking get started, and then feel free to navigate the chatbot system to learn about HIV combination prevention. It has loads of easy to digest information just at the tip of your fingers.
But before we move on to our Q&A portion, allow me to acknowledge our sponsors once more. The Explainer, the National HIV Prevention Month 2020 Kickoff towards a hashtag Safer Now Philippines is presented to us by HIPA Philippines and Champion Community Center, sponsored by Rotary Club Cubao, Quezon City District 3780.
The National HIV Prevention Month 2020 is also brought to us by Jurex, Audit, 3M, LIST, and supported by UNAIDS, AIDS Healthcare Foundation, Filipinas Shell Foundation Incorporated, the Australian Federation of AIDS Organizations, or AFAO, APCOM, and Love Yourself Incorporated.
So let's call on all our guests for today for our Q&A. Dr. Louie, Sir Trio, Ralph, Tony G, Sir Vin, Lester, Robert, and Sir Iko.
Yes.
Welcome back again.
Hello. So let's get this conversation flowing. Earlier, we asked our audiences to comment down their questions below. So anyone from the group can answer the question. And there are some questions that may be directed to any of you. You may need to answer that first. You can allow additional input from other guests afterwards. So are we all ready? We are? Okay. So the first question is, do we have trans-specific centers for sexual health, especially catering to HIV and other sexually transmitted infections?
Hi, I'll be the one to answer that. So for us, Love Yourself is assisting 70 community centers offering sexual health prevention services, right? But within Love Yourself first, we have 2 community centers offering trans health, Victoria by Love Yourself in Pasay and Lily by Love Yourself in Parañaque. So we offer HRT assistance and hormone and transitioning counseling. Our doctors there are also trans women, and we have very friendly trans people who are staff there. So it's a safe space for our transgender community.
Right. Thank you.
Sorry, and also in Cebu, we have Curls, the Vibe Community Center in Cebu, and her with us has a community center offering support also for transgender people. So visit lang po yung mga Facebook pages nila.
Thank you. Now, for maybe question number 2, Nicole, perhaps you can ask this.
Question to all of our guests. What are your thoughts on harm reduction for HIV key population who have history of drug use? Anyone from the panel?
Right.
Pass.
Let me answer that. Okay. In the Republic Act 1166 or the bagong AIDS law natin, there's a specific mention of evidence-based strategies. But unfortunately, very limited yung options natin right now because of the existing war on drugs. So in terms of harm reduction, we're now focusing on, of course, the basic condom and PrEP. And we're now, UNAIDS, in partnership with the other UN agencies, are working on advocating for policy change. But of course, this is a challenge that we have for people who inject drugs because we have limited options in terms of prevention strategies. And that's the challenge that we have, that we need to work on in the next, hopefully in the next few months or few years.
Thank you, Dr. Louis. Now we have another question from Nurse Fran Joseph Bautista. He's also a Safe Now ambassador. His question is, are you in favor of letting young people be educated with HIV or what HIV is all about by blending it in subsequent to the new normal form of education that they have right now? And if any explanation about this or expound would be welcome. So any of the panel.
So, yes. So basically, pre-COVID time, we are closely working with the Department of Education, as I've mentioned a while ago, for the implementation of comprehensive sexuality education, because we believe that if we really wanted to equip our new generations with the correct knowledge and to protect themselves, we need to teach them at the very young age. That's why comprehensive sexuality education should be implemented in school. So as early as kindergarten, we actually introduce sexuality by telling them what is sex, what is a good touch and bad touch, up until senior high school. And at the same time, because COVID is here right now, we are working closely again with the Department of Health that CSE should be integrated into the blended learning strategies of the Department of Health, whether it's a modular type of education, whether it's online education, as long as CSE should be integrated in the specific subjects, like for example, science and health. Kasi importante, lalong-lalo na sa panahon ng COVID, that young people should have access to the correct knowledge. And of course, hindi lang sa information, but of course, services, if they really wanted to access condoms, we are also working with DepEd. Although right now they are not ready to provide condoms inside the school, but we are advocating them to refer those students who would wanted to access condom outside the school, like for example, adolescent-friendly health facilities, na pwedeng ibigay sa kanila yung mga serbisyong hindi kaya sa loob ng school.
Can I add something to what Ralph said?
Sure.
Okay, so we have to understand that the face of HIV is getting younger and younger. So we also have to consider education among family members, because education starts from the home. No? So it starts from there. So we have to educate parents as well to talk to their children, open up, to open the communication line so that they can open to them, especially their sexual encounters and about HIV. We have to continuously pushing for education at that level, because you have to understand, I can ask anybody of you, where did you learn about sex? Diba? Usually sa peers, not from parents. So that's the reason why we have to keep on pushing. Pushing for education among family members, specifically the parents, to keep on educating about sex and about HIV.
Right, because the discussion of that should start at home, and usually it doesn't happen that way. And I'm hearing that if individuals are unable to access help from school or from the education system, they can actually do it externally, which Ivan mentioned earlier. So thank you for the answers. Another question from Jock Domingo is connected to our earlier question. Can minors have access to PrEP or PET without parental or guardian consent?
Okay. Doc Louis or someone could
in our case, for Love Yourself, since we're a private institution, we follow the concept of captain of the ship policy. So if the doctor, based on the assessment that we did and the counseling that we did with the client, if the doctor feels and thinks that the client is at risk, then the doctor can sign in behalf of the client in terms of the consent. Kasi diba, a doctor sa medical practice naman, doctors can decide if this is a life-threatening event and an intervention would be beneficial for the client. So in our case, kung minor yung client, based on the assessment of the doctors, then the doctor signs in behalf. Parang ganon. Or, since we also have social health workers in our community centers, so sila minsan yung nag-endorse.
Thank you, Ben.
I agree with you, no? I mean, like, it's actually proxy consent. When the parents is not available, the healthcare worker can actually vouch the safety of the client. But in the I mean, like in a general perspective, right now, as we develop the guidelines for PrEP in the Philippines, actually na-mention yan sa mga consultations, sa mga dialogue. And right now, the team, the technical working group, agreed to also work with the Council for the Welfare of Children, or yung CWC, to actually include PrEP in the development. Kasi may ginagawa din kasing guidelines for the treatment algorithm for minors, no? At sana doon masama din yung PrEP, at talagang nakikipag-usap tayo sa Department of Health, sa mga partners natin, that young people should not be left behind. Kasi nga, we keep on saying na 15 to 24 years old, but we are not providing services for young key population. So, providing informations alone is not enough. Like, young people should have access, especially for young people who are at risk, and those young people who are not close to their parents, but they are at risk of getting HIV.
Yeah. I agree. Ano talaga, kailangan yung approach natin na hindi single-pronged lang. Kailangan talaga multi-pronged yung approach natin na while we're waiting for the policies, we are doing band-aid solutions. Kasi if we wait for them, medyo matatagalan yun. Pero as you can see, yung ginagawa nila Ralph na advocacy, sila Doc Louie, yung ginagawa nilang fast chat cities, yung mga yan nagko-combine together. Kasi nga, right now, without the policies, medyo gray area siya. But we cannot not do anything in the gray area. So we need to be creative and innovative about these things.
So dapat yung pag-handle ng issue, madaming areas, hindi lang isa. Hey, tama. Dr. Lee, would you like to add?
Yeah, I just want to add, again, bottom line, health providers should think what's the best decision for the kid, for the adolescent, person. So if the young people needs a PrEP, then I think it's the duty of the health provider to provide one. And looking again at our epidemic, I mean, young people are getting infected, and young people are engaging in sex in a young age. So dapat talaga maibigay natin yung all options, preventive options to them.
Now, thank you for all those insights and answers. The next question, I think, is something that's quite close to my advocacy also, which is mental health. From Jeff Domingo, he was asking, mental health has always been an issue associated with antiretroviral therapy. So does the National HIV Strategic Plan address this, and what does our community do in assisting PLHIV on this? I think many of our panelists discussed aspects of mental health as supportive. Perhaps those panelists can elaborate and add.
Siguro from the community side, especially here in Iloilo, we always make sure that the community and even the service providers are really responsive to these red flags that are not just limited ngayon sa sitwasyon na may COVID, but even before, mental health concerns for people who are or people PLHIVs are on treatment already. Tumataas talaga yan. Marami talagang mga cases ng mga depressions or anxiety na level. So, gaya ng pagkakasabi kanina, dapat holistic yung approach. Hindi kailangan na biomedical yung pag makikita na depression, psychiatrist agad yung tinuturo. Gamutan agad yung solusyon. But if we're going to look at other possibilities where we can actually work with other partners or even capacitate our service providers to actually respond holistically on concerns like this, mas mabibigayan natin ng tugon yung mga problema particular sa mental health. Dumagdag pa yung COVID na concern ng mga PLHIVs right now. And just imagine, if we're talking about young people na karamihan sa mga in-cater ng FPUP Iloilo sa Radyo Community Center. More than 60% of our PLHIVs are from ages 15 to 24. Marami talagang concern sa mental health. But we cannot postpone yung pag-start ng ARV because nga dun sa U is equal to U. Kaya kailangan na may mga interventions kaya ng mga gaya sa social workers, psychometrician, parang second level na nga yan. As much as possible, ini-encourage natin na yung idea dati ng support group, na malaki ang support group, we still encourage that, but we encourage more yung parang small cells, yung mga 5 na barkadahan ng mga PLHIVs na nagsisimula, if they feel safe, if they feel comfortable na yun yung napaghihingan nila ng loob, mapapababa natin yung mga mental health concerns, especially yung nagsisimula pa lang ng ARV treatment.
Okay, and additional to that, what's good about the community kasi maraming nabuong organizations and maraming services na nabuo as they come along, as they go on with their organizations. Now, what's good about the community is nag-combine yung efforts and nabuo yung Network Plus. So for all of our viewers right now, if you have concerns, so let's say mental health, you can reach out to Network Plus. It's an organization of different PLHIV groups, non-government organizations addressing the concerns of the PLHIV. And isa doon yung mental health. So if you reach out to us, then we can refer you to the nearest organization that can help you out. This is what's very good about the community right now. And I'm so happy to share that good news to all of you.
Thank you to both Roberto and Pico and Vince.
Dito, Bri, pwede ko bang isingit, syempre, since we're talking about mental health, you as our ambassadress and host for Flourish by Love Yourself. So I also want to share with everyone that since, Love Yourself tests around 50,000 people every year, and we currently have 7,000 plus people living with HIV in our treatment program. So we created a new program that's called Flourish Circle, that's focused on assisting our PLHIVs and other members of the community who have mental health concerns. And we're in the process of actually improving and increasing and diversifying further the concepts of Flourish. So we also have Eliza and Pia Wurzbach, who will be our ambassadress for this Flourish program. So we're very excited for this. And also, Dr. Louie, I'd like to also thank you in advance because UNAIDS is spearheading bringing the new drug here in the Philippines, dolutegravir, right? So I think it's one of the things that would really help moving forward with mental health concerns of potential mental health concerns of PLHIVs who are having side effects with some medications. Yeah.
So exciting.
Yeah.
Oh, yes, Doc.
Yeah, since Vince mentioned about dolutegravir, this is a newer drug with lesser side effects na binibigay ng efavirenz, dizziness and others psychological side effects of efavirenz. So this would somehow lessen yung mental health issues of PLHIVs who are on efavirenz. Hopefully, in the next few months, ay mas start na natin yung rollout implementation ng gamot na ito.
Wow. So a lot of exciting things coming up for the community and for many of the organizations we're part of. Thank you. Hi, welcome back, Nicole. Hi, Nicole. Maybe you can answer it.
Ang dami kong na parang na-miss. Konting minutes lang ako nawala. Pero feeling ko ang dami ko nang na-miss. Grabe. Well, from our last question from Heart Unit, this is a question for all of our speakers. If a client had a viral load test and if he or she is already undetected, how long does undetected state last? And will there be a next viral load test? When and how? Siguro when? Ganon?
Siguro, let me answer that, Nicole. If the client is already undetectable,
Doc, na mute.
If the client is already undetectable, And if that particular client is adherent to the regimen, the next viral load testing, pwede nang yearly na lang. You know, it's safe to say that within that interval, yearly interval, the client is already undetectable. So ganun ka powerful actually yung concept ng U equals U. And just to add, aside from the medical or clinical value of U equals U concept, it's a perfect tool actually to reduce the stigma and discrimination because it gives power back to the PLHIV. Because if you're already undetectable, you're basically the same as a person without HIV at all. Okay, so it brings back the dignity, the self-esteem, and the power to the person.
Yes, and let me add also, in our case, so for every client who are taking ARV, the initial viral load that we do is after 6 months, so that we would know if the client, initially 6 months or even 3 months. Kasi we determine first if the clients have parang side effects sa gamot o kaya naman potentially mukhang hindi gumagana yung gamot. So, bina-viral load natin sila. Pag nakitang hindi nag-change yung viral load, what we do is we send a sample of their blood to our ITM for checking for potential drug resistance. Yun rin yung isang function rin ng viral load testing natin. And of course, the U equals U. And all of the viral load testings, kapag yung inyong facility is PhilHealth accredited, normally it's for free. Or kaya naman may konting charge yung institution, kunyari pag-manage ng dugo or something like that. Yeah.
Okay, just to answer the question directly, so your undetected state is as good as your last viral load test result. No? There are cases kasi na kapag undetected na yung status ng isang client, they care less about themselves. No? So it's very important that we emphasize that if they already have this undetected state or status, they still have to be adherent to their medication, follow whatever it is that their doctors or their nurses tell them to do. No, so still they have to take care. And then to answer lang yung how frequent do they have to get tested for viral load, I would agree with Doc Louie and Sir Vin na after the first 6 months of the treatment and eventually after or annually.
Annually, so yearly. Thank you, Trio. Thank you, Vin, and thank you, Doc Louie. And thank you to all our panelists who joined us for today. Nico, everyone who was speaking. So I think we just have enough questions, and I'm sorry, and we apologize for those whose questions were not answered or asked to the panel. Fortunately, you can go to our Safe Spaces PH chatbot and you may find some answers to your questions there.
Yeah, that's true. I believe that it is. Thank you to our guests again who have been very patient with this event. And we also want to thank our viewers for being us tonight with this momentous event. Thank you to everyone.
Right, so thank you everyone. Doc Louie, Trio, Iko, Jet, Ivan, Roberto, and of course Vin, and my co-host Nicole. Thank you. Before we forget, our next event is Condoms and Lube Day. That's on August 8th at 5 p.m. on this same social media page. So we also hope to see you all there.
Please check everything out, okay? Join us on the hashtag #ShootTheRubberPH, as well as to win as much as 10,000 pesos. Watch out for the other announcements that we will have in the next days to come, especially the free PrEP bottles for 3 months. Exciting, diba?
Yeah, exciting. And thank you for that again, Nicole. So this has been Brian, leaving you with the same. You now have the power to protect yourself, so please be kind to yourself. The HIV combination prevention methods are tools to help us make ourselves safer and other people as well.
Yeah, tama yan. Again, this is Nicole Silvestre, leaving you a message to hope to stop HIV is still burning. And I wish that everyone that can see that this hope is fueled by taking care of ourselves. So please love ourselves.
Right. So This is the Explainer, the National
HIV Prevention Month kickoff
towards a hashtag
Safer Now Philippines.
Thank you, everyone, and good evening. Thank you for joining us.
Thank you.
Thank you.
Bye.
Bye.
Thank you. Bye, guys.
Ingat.